Hello, bladder cancer warriors. Today I want to talk about an important part of the bladder cancer journey that not everybody thinks about all the time, and that is caregivers. Depending on the age of the bladder cancer patient, caregivers can be parents, they can be spouses, or they can be your children. My caregiver and my most important person in my journey was my wife, Heidi. I can't emphasize enough the role that my wife played in my care, starting with the mountains of paperwork you have to fill out as you go through different specialists working toward a diagnosis, then working as an advocate for me and trying to get appointments, trying to get them moved up because sometimes the appointments were 2 months away and you don't want the cancer to grow for 2 months, so you want to get it taken care of. It then rolls into things like wound care, and it ends up being a second person to hear from the doctor at the appointment so that you're asking the right questions and making sure that you're hearing all the important things that the doctor says. But then there are also low moments that you go through as a bladder cancer patient, and that was something special that I wanted to highlight. I waited 5 months from the onset of symptoms to my first BCG appointment. And so I built up a lot of anxiety in the process. And I got to the first week of my BCG appointment, and when I got there, my urologist made me take a urine test. And the urine test was important because they want to make sure that you don't have anything that looks like a urinary tract infection, because that can interact negatively with the BCG. And so unfortunately, they saw something in my urine they didn't like, and they sent me home. That was the lowest point of my entire journey. But I was so happy to be able to have a wife like Heidi and a caregiver like Heidi who was at my side. She came up with this scheme with my friends, my coworkers, kids from my school, all kinds of people, where she got them to send in pictures because the next week would be my first BCG appointment. We knew it, we were gonna be positive, and everybody was holding up one finger. And she gave it to me the night before the BCG treatment. She printed it out as a collage, and it really choked me up and got me emotional, but it also showed me what a community I have around me. The second week of my BCG treatments was actually Easter week, and so then she had people putting up 2s, but then people got really creative and they started doing things with bunny ears, because that was also a number 2. And so that got me laughing, and that just carried on through the 6 treatments. It was just a little thing that she did that cost $0, but really made a big difference in just my positivity and my attitude through the process. Being a caregiver and an advocate isn't always cute, isn't always pretty. Eventually it evolved into changing my catheter bag, making sure I'm taking my medications, wound care. There were lots of aspects that weren't pretty about it. And actually I'm really excited because Heidi has started to tell her story. And so you can follow her on TikTok because she's starting to release her story and her perspective of being a caregiver to a bladder cancer patient. And I'm so excited that she's starting to do that. So make sure you give Heidi a follow and check her out. And good luck to all of you on your journey, whether you're a caregiver or a patient.